we know that we need to improve the skin's texture and quality for a better result. So one way of doing that is by targeting the dermis. And this is the beauty about this combination, about the skin boosters and the lasers and this clear leaf laser you just heard about. With this combination, you actually target the dermis in two different mechanisms. First of all, collagen remodeling, and the second is deep hydration. And this is a safe, painless procedure with no downtime. So the first part of the treatment is the clear leaf. You just heard a lot about it, so I will skip. This is a fractional non-ablative device. It reaches the dermis level and actually combines the benefit of a non-ablative and fractionated laser device, which means a controlled dermal wound is produced but without harming the epidermis. So as a matter of fact, all stages of wound healing occur but under the biologic protection of intact epidermis. Now, the second part of this combination are the Restylane SkinBoosters. So the skin boosters are innovation from the makers of Restylane fillers based on the natural technology. These are not fillers. They give the skin deep hydration, and by this, they improve the skin's elasticity, firmness, and smoothness. The skin boosters are administered as a series of micro-injections which are injected into the mid or deep dermis, and since this is a stabilized form of HA, the results will last for a few months. This is a very nice treatment. It's quite a versatile treatment since both younger patients and older patients can benefit from it. It's a very good treatment for men since the result is very, very natural, and it is also an option for improving acne scars. Another advantage of this treatment is that it can be performed not only on the face but also on delicate skin areas such as the neck, the chest, or the back of the hands. The work with the skin boosters is quite easy to perform, and this is due to the smart click system which is incorporated into the syringe. It actually allows you to deliver 10 microliter of HA for every subtle click that you hear. So it means that the work is very gentle. You can concentrate on the work itself and not on the amount that has been injected. The technique, you can inject it either with a cannula or with a needle. Personally, I prefer to inject it with a needle, and it can be done either in a micropuncture technique or in a linear technique. And regarding the protocol, well, I have to tell you that the protocol has changed over the past few months. Currently, my protocol is first of all to perform the laser treatment and then immediately followed by the injection of 2 cc's of Restylane Skin Boosters, and this is all in the same session. Usually you get quite significant improvement and you don't need another treatment for the next 6 months. So I'll show you some results. As you can see, this is a patient with quite reduced skin quality, and you can see very significant improvement after 1 treatment only. Please keep in mind that when we are talking about skin quality and texture, the changes are subtle and it does not always reflect very nice in the picture, but the overall appearance of the skin is much better. As you can see here, a younger patient, very nice improvement in the skin texture and hyperpigmentation. And as I was saying, this is a good treatment for older patients, and for younger patients, look at the nice improvement in the skin's quality. The skin looks nicer, it looks brighter, and this is a completely new entity, a completely new attitude. This is something we didn't do before. This is a patient of mine. I used to do fillers on her, and now she came to me and I offered to do the skin booster in the combination with the laser, and look what a nice result. And this is another patient of mine. As I was saying, it's good also for older patients, and you can see here very nice result on the back of the hand. And now regarding the skin booster. So this is the second part of this combination. So the idea here is just to evenly inject the HA over the whole area that is being injected. I'm not trying here to fill a specific wrinkle. I'm trying to treat the whole skin as a whole. I want to improve the overall appearance, the overall look and the texture of the skin. So what I was doing here is a linear technique. You can also do it in a micropuncture technique. Personally, I prefer the linear technique, but when I'm treating acne scar, I use the micropuncture. You can also use it with a cannula. And just keep in mind that since it's not a regular filler, don't try to fill wrinkles with it, but rather to spread the HA over the whole area. And thank you very much for your attention.